It's great to be here with everybody and this topic that's very important from my perspective as a practicing clinician who takes care of the overdoses. I'm a professor of emergency medicine and pediatrics at the University of Virginia. I came to Virginia in 1999 and I assumed oversight of the Blue Ridge Poison Center. Blue Ridge Poison Center covers half the state. For Poison Center services, and I cover 74 hospitals, everywhere from very populated areas up into Alexandria, Northern Virginia, down to very Southwest Virginia and rural areas. And we're seeing kratom in all these areas. I also created when I came here the Division of Medical Toxicology. What does that mean? That means at University of Virginia Health, we actually have a center that cares for patients who are addicted or who have overdosed. And we are the gatekeepers for transfers from the hospitals in our coverage area for coming here and getting care in the intensive care units, our floors, and our emergency department. And such as today, I'm on call. We'll make determinations as to how we care for these patients, and we help our clinicians at the other hospitals in managing these patients. And then finally, in 2013, because of the credible threat of substances that were entering society, I assumed leadership of our Department of Student Health and Wellness. And this is on the wave of bath salts, the synthetic cathinones, and the synthetic cannabinoids, K2 and Spice, that came out at that time, and care for our student population at the University of Virginia, looking at doing best practices. And we have seen kratom in our addiction services, in our overdoses in the intensive care units, on life support, and in our student population, including with addiction. There's a study that we published just recently that took a look at America's poison centers, the data, which is the National Poison Data System. There's 53 poison centers in the United States. Each poison center submits de-identified data. In other words, when calls come into our poison center, it is de-identified and it gets uploaded every 5 minutes to a national database that then works with federal entities and doing surveillance. And when we start to see upticks in certain areas, such as overdoses with kratom, that starts to put out warnings. And there's public service announcements. There's talk that we do in the communities about warnings and things that we're seeing with products that start to emerge. The study that we did was published in MMWR along with in March of 26. And what we looked at were the trends. So our aim was to characterize the trends in kratom-related poison center exposures over an 11-year time period by exposure type, single substance or multiple substances, meaning that it was not just kratom but another substance, demographics, sex and age, as well as clinical outcome. We looked at the National Poison Data System. We looked at the population greater than 12 years of age. We separated it into age groups, and we looked at the hospitalizations, critical care, non critical care, psychiatric, serious medical outcomes, as well as other data associated with those overdoses. What we found over 11 years, there was an increase of 1,200% high compared over that time period. In other words, there's been a rapid rise in the calls to poison centers regarding kratom and kratom products. Most reports involve males and young adults ages 20 to 39, but the reports among adults age 40 to 59 have increased most sharply, with rates nearly overlapping with those in the young adults. Single substance exposure reports accounted for most reports, 62. Multiple substances were associated with more hospitalizations, serious outcomes, and the vast majority of the deaths, but realized single substances were associated with those also. If you look at that data, this is showing the rise of the calls to the poison centers, giving us some idea of what is the prevalence in society. This shows single versus multiple substances, both the frequency, the number of exposures, and the rate of what we saw. And you can see the steep rise that has occurred, but certainly has been a steady rise over the last decade. And this gets into the male versus female on the left to give an example of sex, but the age group look at also. There's been an increase in each age group, including the age group of 12 to 19 years of age. So it is not just those over 21 who are getting their hands on these products. And that's certainly true in my practice too, and including with the collegiate and high school populations that I'm dealing with. If you look at hospitalizations and serious medical outcomes, single substance and multiple substance are both associated with them. In my own clinical practice, I have intubated and been involved with kratom overdoses that have been on life support. And tremendous concerns as we see this growing in our population, in our addiction clinics, as well as in our hospitals as these cases continue to increase. We're also seeing combined products, and this is fairly new. Products such as Feel Free, Convata. These products that you see on the left were bought across the street from what we call grounds at the University of Virginia, our campus. These are readily available to our student population. They can also buy these easily online. But today I pulled off K-Bomb Kratom. You can buy the product, have it delivered directly to your house. A combination product of kava, which has effects that are similar to a benzodiazepine like Valium, combined with kratom in a product, and these are being touted as alcohol substitutes to the youth. We did a study on this too, looking at kava and kratom reports, and kava exposures declined sharply after 2002. It was associated with liver injury, and there are FDA warnings that came out regarding that. And there's been a steady increase in kava drinks that have occurred. But what was really interesting is finding that the kava kratom combination actually was reported with much more severe neurologic effects, including sedation, coma, seizures. So certainly the product combination between the two of them seems to be the most problematic. We talked earlier about metabolism, and I want to highlight this just a little bit more for those of you who are involved in the laws. One of the problems we have, I at the University of Virginia can actually detect metragenine, 7-hydroxymetragenine, pseudoindoxil. I have a phenomenal pathology lab and toxicology lab that has worked to develop these methods. The other 74 hospitals can't detect these. And I can't be clear enough. This is really problematic because it skews the data that's out there, meaning that the reports we have are based purely on clinical, but we cannot do analytics on these unless there are deaths, and it goes to forensics. And even that goes out to highly specialized labs in the country. The other thing is that we're finding, and we're doing research on this currently, is 7-hydroxymetragenine is not stable in serum because it gets metabolized in the serum to pseudoindoxil. That means even under refrigeration, we're finding it is being metabolized and the levels will drop. So if there is a death and that body is not found for some time, the potential for 7-hydroxymetragenine to be metabolized and gone by the time they do analytics is a possibility based on what we're finding. And so I have a tremendous concern regarding the analytics. Examples of products, you can buy the kratom directly. You can get tablets like 7-tabs, one of my first overdoses that I intubated here at the University of Virginia. And now we're seeing pseudoindoxil, a more potent opioid that is hitting the market and is across the street from my campus. And it's not acceptable from my standpoint. Now we also have MGM-15. This just came out in a report. The Drug Threat Analysis Group put this out. We actually just bought this to try and be able to do analytics on this. This product you can buy, and you can see a number of things and resources here that I just pulled off the web today, where I can have this directly delivered to my house. That is also a potent opioid and a new semi-synthetic derivative of this product. And I'm going to finish up with this report. 2013, the United Nations Office on Drug and Crime published the World Drug Report. This is on the following up to what we saw with new synthetics coming out, what really led to kind of a wake-up call for us when we saw the bath salts, K2 spice hitting the market. In their report, while new harmful substances have been emerging with unfailing regularity of the drug scene, the international drug control system is floundering for the first time under the speed and creativity of the phenomenon known as new psychoactive substances. MPS are substances of abuse, either in pure form or in preparation, that are not controlled by the international drug conventions, but which may pose a public health threat. In this context, the term new does not necessarily refer to new inventions, but to substances that have newly become available on specific markets. In general, MPS is an umbrella term for unregulated psychoactive substances or products intended to mimic the effects of controlled drugs. And I'm going to put out there that kratom and its offshoots, 7-hydroxymetragenine, pseudoindoxil, and now MGM-15, absolutely fall under this and are too reminiscent of times past when we've had to work hard with our politicians to try and get these off and keep our communities safe. So be aware, this is certainly very real to us at the University of Virginia. We're seeing multiple overdoses. It's in our addiction clinics, and it's truly problematic.